Pfizer-BioNTech vaccine is eluding the strain that's developed there?
Is what, sorry?
Is eluding it? Was the word
Okay, so whether it's matched to the strains or not.
That's right,
Yeah.
I think their research showed that the vaccine basically wasn't effective against the new strain, which is now a reality. Is that a concern for you?
Yeah, I mean, there's obviously a concern with strains and as strains mutate. So the data to date on the Pfizer-BioNTech vaccine is looks like it's got a good match to the English strain, the variant. There might be a slight shift away with the South African strain, but it's still looking effective. But this is something that we're going to have to keep watching closely. And these vaccines, these RNA vaccines, are capable of being modified very fast if they need to be. At this stage, we're confident that it's still looking effective against the major circulating strains that we're facing, but we're monitoring really closely.
Is there a risk that the virus will outpace the vaccines?
No, interestingly, because this new technology we now have with these vaccines, we're pretty confident as a science community internationally that we can adapt. Obviously, the problem is if you adapted and the strain then got widespread, you'd have to revaccinate. That would be the downside, but there's a lot of confidence both in these RNA plus in the other vector vaccines that you can adapt them quite fast.
Just want to talk about the distribution and the logistics.
Yeah.
The ministry hasn't even gone to tender for the company that's going to distribute them. They're using the company that I think is used for the influenza vaccine distribution, which was problematic last year, obviously. Are you confident that we've got the logistics in place to distribute this nationwide?
Yeah, well, because I'm not the Ministry of Health, so I'm not in charge of logistics. All I can say from our end of it is that we all learnt a lot from the problems with distribution and flu vaccination last year, and we have been, as the sector, assured by the Ministry of Health that the distribution approach this time is entirely different from last year. We're the sector, and we're going to hold the Ministry to that, but we do understand that they're taking a totally different approach, and they're monitoring very closely. So what happened last year is it got distributed but not monitored where it went, so you had lumpy distribution. My understanding is there's going to be much tighter monitoring of how the distribution goes out this year.
Dr. Turner, this is one of many vaccines that's been rolled out here over many decades.
Yeah.
What is the upside, if you like? What has been the effect of us having vaccination in our population here?
Yeah, I think this is a really important question because out of sight, out of mind, people forget where we started from. You know, we have eradicated smallpox from the world, and we need historians to stand here and tell us what the world used to be like. You know, so we have got elimination of measles within New Zealand. Our children do not die of measles. I can't stress enough what difference vaccines have made. We no longer see congenital rubella in our community. We don't see children who are brain damaged and severely damaged from measles and rubella. We hardly ever see mumps anymore, and many of us will have remembered childhood mumps and people who go deaf. You know, we still have problems with whooping cough in the New Zealand community, but children are not dying at the rates they used to. You know, I think the problem the world has to learn and New Zealand has to learn is once we get on top of a disease with vaccine, we forget. So, you know, let's remember now we're in the middle of a pandemic and these vaccines are performing extremely well. If anyone's been watching the data come out of Israel, the data beginning to come out of the UK, it's extraordinary, and we will forget very quickly. We've got very short memories, so we do need historians to remind us.
Historically, though, our rates of vaccination are low. New Zealand's rates are low compared to the rest of the world.
No, New Zealand rates of vaccination are not low compared to the rest of the world. There are countries that do better than us, but New Zealand is doing better than many other countries, so we're not the bottom of the pack here. We've got childhood rates of immunisation somewhere in the order of between 90 and 95%. We do have some equity gaps, but my goodness, we do better than most countries in the world. I think Australia is beating us slightly, and the UK is probably better than us, but we are better than many other Western countries, and particularly many other countries in the world. So we can do better, and we should do better, but we're by no means the worst. Sorry, I think you had a question.
Yeah, just wondering how the training's going, how many people have been through it,
yeah,
and what's still to, how many more?
Yeah, so don't hold me to the exact figures today. Our organisation would have to get back to you. But we've got, I think, well over 700 people going through our training at the moment. But of course, you know, we've only been up and running a week here. You know, we've got training modules, they're going to improve. It's not just the training modules, though, that what we really need to do and continue to do is talk to everybody about what these vaccines are, how they act, what their safety profile is. So we've been doing a lot of teaching seminars, webinars, getting materials out there to the sector so we can all communicate. We need to do a lot more of that. We've got a lot more to go.
Is there any vaccine resistance from within the health sector?
There always is. There's always some hesitancy and concern in vaccines. We've seen this with flu vaccines for a long time. You will always have people out there with concerns, and you'll always have misinformation that we'll be struggling to correct. So yes, there is some.
Even within the health sector?
There's very little within the vaccinating primary healthcare health sector. I think the people who are out there doing the job, you'll see very little vaccine hesitancy. But within the broader health sector, you know, people hear stories, they get nervous. You know, there's a lot of magnification of stories out there in social media. So you will always have people that are anxious, and I think our jobs is to try and get the science packaged and communicated that makes sense, both the stuff we know and the things we don't know yet, because there's still a lot we don't know yet.
What vaccination do we need here to have for there to be herd
For herd immunity. Depends on the disease. Every disease acts differently. For COVID, okay, well, this is a bit of a moving feast because we're learning about COVID, and everybody would have heard about R-naughts by now and where it lands. Approximately, at this stage, around about 70%, which is relying on whether the vaccines do reduce asymptomatic transition. So there are big unknowns here, so we cannot put a stake in the ground and say we need this target yet. We have to just hold our breath a bit and get out there and individually protect as many people as we can, and we can come back to this question again over the next few months. So that 70% is a moving figure, not a fixed target, but it's around about that. Okay, but it does depend how well the vaccines act and if the strains don't evolve too fast.
Once the vaccine rolls out to the wider public, how much of a risk is complacency in your view?
Oh, well, I think initially not at all, because our memories aren't that short. So most of us are going to remember this pandemic for quite a long time. So I don't think there's going to be immediate risk of complacency. I think there is a risk that we will ease up on our personal protection, our hygiene, our social distancing. You know, I'm concerned that we think vaccines are the magic bullet. Now, vaccines, I think and I believe, are extraordinary, and they're going to have a really important part here, but they're not the magic bullet to totally cure the pandemic. So that's the complacency I'd be worried about, is that, you know, as I said, this vaccine is around about 90 to 95% effective against symptomatic disease. That does mean some people will still get disease, and we will probably still have some degree of transmission, so we can't afford complacency.
Last question. There have been calls to have a Maori specific vaccine program rolled out. Why can you see that as having value, and what's your opinion?
It certainly does have value. I think that the important thing, particularly about vaccine hesitancy, is communities feel safe with their healthcare provider and their healthcare provision. And by Māori, for Māori, healthcare provision to communities who feel safe with the healthcare services, it's a big, important part of our overall health service. So we need mixed models and mixed approaches, and I absolutely support it as part of our approach. Yeah, I'm happy for a few more, I don't mind. Kia ora.
Thank you.
Thanks very much.
All right. I probably won't need my notes. Questions?
How many people have vaccine today?
Around 70, I understand, was we were going to get to. And yesterday we had planned for 25, but we managed to get 29 of the nurses vaccinated yesterday.
The 70 today, what's the plan? And so just purely at Jet Park today, what's the plan on Monday?
Yeah, so starting at Jet Park because it's the quarantine facility and there'll be more vaccination there tomorrow. Then Monday it starts to extend out into other sites here in Auckland for MIQ workers. There won't be vaccination in every single managed isolation facility, but you'll recognise a number of them are in central Auckland, so there will be a site set up or several sites set up for the workers to get to. And then from Wednesday, same in Wellington and Christchurch, starting the rollout there with the managed isolation facility workers in those cities.
So can you give us any idea of numbers, locations of how many MIQ or testing facilities will there be and how many people are you targeting for the start of next week? How many workers do you think will be there?
I don't have the exact numbers, but again, in each site, as we've done this week in Auckland, I should say the dry run that was talked about, the last one on Wednesday, included Canterbury and Wellington, so they've been part of that end-to-end dry run. And then I was just talking to Dale Bramley, who's the Chief Executive at Waitemata, about the process they put in place here to sort of do an initial review, then do what they call the wet run, then audit, and so we're going to take that process and do it in the other centres as well, so they can emulate that, the learning from up here. So we will on Monday give an idea of what the number of expected vaccinations is we will do through this week. But remembering we've got about 12,000 managed isolation and quarantine workers and border workers, which is a wide range of people, and so there will be, as we go day by day over this coming week or two, we will increase the sites and then out to different workforces. So we're imagining by the first 3 or 4 weeks' time, we'll have given them all the aim is to give them all their first vaccine. Of course, then we'll be starting to give them the initial people that you saw today their second dose.
What are you saying
Any
to
indications of border workers refusing the vaccine yet?
Well, there's been a lot of discussion about this, and the approach we're taking is consistent with the government's overall approach. The vaccine is not mandatory. And I think you heard it here from the folk we had in the earlier media stand-up. The key thing that will help people determine whether or not to be vaccinated is they feel confident about the information, that it is good, reliable and balanced information, and that the experience is a good one, and they will talk to people around them. So saying, some of the border workforce employees are thinking about if they do have people who for some reason are not vaccinated, and they may have health reasons why they can't be vaccinated, whether there are other ways to redeploy them within the workplace setting to take them out of that frontline role.
What are you saying to people about cautioning them about side effects and then monitoring them?
Yeah, so 2 things here, and you may have heard, Dr. Turner may have talked about this. Actually, what we're seeing with these vaccines is they're quite, the word is reactogenic, so people do, the actual mild side effects or symptoms are common. That's because the vaccine is working, so that's not unexpected. We're making sure people know to expect that. And another point here is that, of course, we're not vaccinating all our workers in a facility on one day, and because we don't want to find that 2 days later, and there are several of them off work with side effects, and we can't run the facility. So there's a lot of work with employers to stagger the vaccinations. We have got a very robust monitoring system in place. It's through our existing agency, the Centre for Adverse Reactions and Monitoring. That's funded by and works closely with MedSafe, which is our independent regulator. And any adverse reaction, whether it's mild through to severe, will be documented, and we've got an independent committee that is looking at those regularly and will give us advice if there is any concerns about the vaccine.
There's reports from Reuters today that Pfizer has asked for the temperature. It's saying that the temperature can be lowered now. It's applied for American approval for it to be stored at much lower temperatures, around 25 to 20 minus 25
Right.
to 20
Yeah.
Celsius, 13 to 5 minus Fahrenheit. Have you heard about that? Is it something that would...
Yeah. I haven't heard about that. I think that it's probably a warmer temperature. So at the moment, the vaccine from manufacturer all the way through to New Zealand and in our freezers here is at minus 70 to 80 degrees Celsius. It is then taken out when it's going to be used. It takes 3 hours to defrost. And then you've got a 5-day window to use it. And during that window, it has to be kept at a 2 to 8 degree temperature, which is the same as for other vaccines. It's the normal cold chain. So what they may be saying is actually it doesn't need to be kept at those really ultra low temperatures. But for us here, we've bought the freezers to do that, and we've got a system that's based on that at the moment. That may be something, if we continue to use Pfizer in a wider rollout, that we would think about whether we had other freezers available that could store it at that not quite such a cold temperature.
And do you know how long it might be till you get any data about whether the vaccines prevents transmission? You know, for people who've been having all the swabbing, they might be looking forward to an end to it, but there's none in sight, is there?
So just on the swabbing, we will be continuing to do the swabbing, because remember, it's not just those people. Well, there are two things here. One is the vaccine is highly effective, and you heard Dr. Turner say that it's one of the most effective vaccines we've got, but it's still 90 to 95% of people who will become immune when they've had the vaccine. There will still be 5% of people who may not be immune. So we can't afford to take any of the layers of cheese out of the Swiss cheese lineup, the lineup of slices of Swiss cheese at this point in time, and particularly not till we've got the wider population vaccinated. So saying, I heard even this morning there is now data coming out of the UK about the impact of the Pfizer vaccine on reducing transmission. And the report I heard this morning, and we're looking for the scientific data behind it, was that already they're able to say it reduces transmission by 2/3. So that's the contribution they think it is making to the reduction in cases they're seeing in the UK.
I just want to before whether have any border workers refused a vaccine yet?
No, they haven't as yet. And remembering at the moment, we're just in the process of enabling them to book in for their vaccines. And of course, and there's been a really great response there. And we've been putting a lot of work in over the last couple of weeks with making sure that that workforce is really well informed, working closely with their a range of private and public sector employers, just to make sure they've got good information.
Will the likes of yourself and the Prime Minister be getting vaccinated, and if so, when?
I will definitely be getting vaccinated, and the PM has said she will be too. We had some questions about this in Wellington a few days ago. I'm very keen to get vaccinated at the right time. I'm not in a high-risk group, and I don't want to give any sense I would be queue jumping. So saying, there are also a lot of people saying to me, you being vaccinated would provide some people with a high degree of reassurance. So I've still got to finalise with my team when we think that the best time might be for me to be vaccinated. I won't hesitate to it. I may not be quite as bold as Simon Bridges in my acceptance of the vaccine, but I could tell Mr Bridges that we are able to give it in his arm. So, and I can reassure other New Zealanders that it's a vaccination in the arm.
There's still massive anxiety amongst the Maori communities around this vaccine. Why do you think that is? And also, there's been a call for a Māori-specific vaccine program rollout. What's your opinion on that?
So I can understand people's anxiety, and some of that anxiety is because they, as our speakers said earlier on, just really want to be assured about the safety, and they've got questions about it's being developed quickly, can we be confident it's safe? We will keep working on ensuring people that it's safe, and I think as communities see people being vaccinated, like our people who were vaccinated who were here today, they will become increasingly confident about it. I think the second thing is that there is misinformation out there, unfortunately. So we've got a really big job to do to make sure there is really good information, and that we are out there making sure that that information is accessible to all people and through a range of channels. With regards to your latter question, in fact, and I think you might have got a sense of that today, we've got and have had right from the start a really strong focus on reaching to our Māori communities and indeed our Pacifica communities, and that is right through our program. So what we are now working on is how we enable our Māori and Pacifica providers to really get out into their communities from early on, not as an afterthought. And so we've got, I think, really good leadership from Maori and Pacifica health people across our program, and they've got full support of the whole program to make sure we do get out into these communities, and that community leaders support our mahi out there with them.
What specific steps are you taking to ensure that there won't be a repeat of the logistical issues that happened with influenza vaccine last year?
Yeah.
Like what specific steps have you taken? Like what assurances have you given to the healthcare community?
Yeah, so the distribution of this vaccine certainly at the moment is very different. Our influenza vaccine, uniquely amongst our vaccines, is one where actually it is owned by and distributed by the manufacturer, whereas other vaccines the government buys and owns and then distributes out. So there's always a bit of a challenge with influenza. So saying, with this one, and particularly with the Pfizer vaccine, because of the logistics around the cold chain, we have had to stand up a whole new logistics system and a track and trace system we have done specifically for this vaccine. You might have also heard already Te Puea Winiata talked about the new COVID immunisation register, and she commented, and I was pleased to hear that it's user-friendly, but that is part of our system to track and trace every vaccine that is given, and then that helps inform our distribution, which will be needing to be happening on a daily basis out to those who are doing the vaccination.
Is there going to be an allocation system like with MRQ with vaccines? Is there going to be an online portal that will book in vaccines? If that's
Yes, so we're working on, people are booking themselves in for vaccines at the moment. It will, at the moment, it's not a wider online portal, but that will happen as we move into the next phases of the program, that there will be an opportunity. And the reason that it needs to be pretty carefully controlled from the centre is to make sure we've got the right number of doses out where they need to be, and also there is this aspect of requiring people to come back 3 weeks later, so there's timing and logistics around that as well, which is a special challenge. Please.
How much of a silver bullet is the vaccine, and if it isn't, are you worried about complacency once the vaccine gets out there and most people are jabbed?
Well, it's not a silver bullet, there's no doubt about this, but I do want to endorse the comments that Dr. Turner made. Actually, this is a really good vaccine from both an effectiveness and a safety perspective. So it's got a huge part to play in our response. This is the year when we will really be able to shift our response to COVID-19 if we can get high rates of vaccination with this good vaccine. In the meantime, we've got to keep doing everything else we're doing, and that's going to be really important, you know, and that's why you'll hear our messages. We'll keep continuing about that. We can't afford to get complacent. We have had a really successful 12 months. You don't need to look too far beyond our shores to see actually the impact that this virus can have, and I can't imagine the challenge in communities of where they have widespread COVID-19 outbreaks. Of trying to distribute and vaccinate vaccinate their populations. I think we've done a great job, and we're in a privileged position of been rolling our program out in a position with no community transmission, and we need to hang on to that. Final questions?
Has the next batch arrived yet with the vaccine?
I can neither confirm nor deny. Thank you very much. Thanks again for coming. Cheers.